In the room, so we'll get the meeting going. Started. Once again, good evening, everyone, and thank you for attending this evening's meeting. I do appreciate the time that each and every one of you take out of your busy schedule to come and attend our public Board of Health meetings. And on the agenda this evening, by the way, before I go to the agenda, I just want to make a self-declaration. I do have a cold, so don't come near me, please. And secondly, in terms of my voice tonight is a fake voice, so again, don't pay attention to that either. Having said that, I do want to get to the agenda, and what we'll do is we'll go through the agenda in terms of okay. Sorry about that. We will start. There are three ceremonial events for this evening, so I'll start with those, and then we'll come back to the consent agenda. Bonsoir, good evening. And like I said, we've got a couple of ceremonial presentations this evening, and first starting off with a recognition of contribution to the World Economic Forum report entitled Migration and Its Impacts on the Cities. On October 25th, the World Economic Forum released a report entitled Migration and Its Impacts on Cities. The report provides a deep dive on migration in cities, exploring the types, causes, and patterns of migration, the most affected corridors and in cities, and the impact on urban infrastructure and services, the solution that can be employed, and how cities can seek to further prove themselves to address this growing challenge. The report captures the mitigation stories from 22 of the most affected cities around the world, including Ottawa, and presents a high-level framework to achieve long-term migrant integration and in delivering urban infrastructure and services efficiently and effectively to meet the needs of the migrants. Today, I would like to celebrate Ottawa Public Health's contribution to this report by recognizing the individuals who developed Ottawa's submission. I would like to invite the following recipients to come forward to accept a certificate of appreciation: Eric Leclerc, Inga Rosendahl, and Marcella Tapia. Congratulations. Thank you very much. And Kim Trotter and Dr. Carolyn Pym also are participants in developing this submission. Unfortunately, they could not be present this evening, but I would also like to acknowledge their contributions. Our second ceremonial is the recognition of Centers for Addiction and Mental Health, CAMH Difference Makers Award. In April 2017, guided by a national committee of leading experts and advocates, the Centers for Addiction and Mental Health launched a cross-Canada call for nominations for difference makers influencing change, and giving new hopes in the area of mental health. From the 3,700 nominations received, I am very proud to announce that the supervisor of Ottawa Public Health's mental health team, Benjamin Lakin, was chosen as one of the 150 leading Canadians for mental health. Inspired by his own personal and family mental health challenges during his youth, Ben is on the mission to keep mental health at the top of public health agenda by helping communities and businesses, leaders, politicians, healthcare professionals, city staff members, and all residents of Ottawa think and act differently about mental health. Ben worked with others to get mental health programming included as a requirement for all public health units in the latest version of Ottawa's public health standards. He served as a project lead for the development of the National Mental Health Caregiver's Guide, which is used by hospitals, the Canadian Armed Forces, the Canadian Mental Health Association, and others. He made history when in 2015 he succeeded in getting the Safe Talk workshop added to Ottawa's Learning Centre programming, thereby becoming the largest municipality in the world and first in Canada to make a suicide prevention training available to all City of Ottawa employees and making the city stand out as a leader in workplace mental health. Ben is also a member of the numerous mental health related volunteers initiatives and an invited speaker at provincial, national, and international mental health conferences. I would also like to mention that Ben was nominated by 2 additional organizations besides OPH, a true testament to his passion and dedication in our community. I would like to invite Ben to come forward to accept a certificate of recognition on behalf of the Board of Health. Please join me in congratulating Ben. Our ceremonial 3, which is recognition of Ottawa Public Health's nomination for the 2017 Ottawa Rideau River Spring Floods Response and Recovery. I would like to invite members Chernyshenko to present this next presentation as Chair of the Environment Committee.
Thank you very much, Shad. Yes, as Chair of the Environment and Climate Protection Committee, I'm very proud to announce that Ottawa Public Health was nominated for the Environmental Excellence Award for the Department's leadership and dedication during the 2017 Ottawa Rideau River Spring Floods Response and Recovery. Working together as a team across 11 departments, Ottawa Public Health's support helped to maintain essential services to the community. As a valued member of the Flood Recovery Task Force, Ottawa Public Health also helped with the cleanup and restoration of the affected communities while protecting the environment. Michael Ferguson, the incident commander of the Ottawa Public Health effort, has graciously agreed to accept this recognition on behalf of so many at Ottawa Public Health. I'd like to invite Michael to come forward to receive this certificate in recognition of Ottawa Public Health's nomination for the Environmental Excellence Award and in appreciation of all employees who contributed to the 2017 Ottawa Rideau River Spring Floods Response and Recovery.
Thank you very much, Councillor Chernyshenko, for that, and congratulations. Our final presentation for this evening is for Dr. Israel Levy. Last but not least, I would like to invite Dr. Israel Levy to come and join us at the front here, please. As most of you know, today we say farewell to our medical officer of health. In his almost 10 years as a medical officer of health, Ezra has shown strong leadership and passion for creating healthier communities across Ottawa. During this time, he guided the organization through an accreditation designation of exemplary standing, which is the highest possible level of accreditation. He embraced innovative ways of advancing healthy policy that make progress on health challenges such as tobacco and alcohol use, as well as vaccine coverages among Ottawa children. Ezra also leads OPH with professional and dedication through the 2009 human influenza H1N1 pandemic, the management of the largest patient notification process in Canadian history, the expansion of the City of Ottawa smoke-free spaces legislation, and the implementation of an independent board of health. Most recently, he has worked with community leaders on the expansion of harm reduction services in response to the current opioid crisis and helped OPH prepare for upcoming changes in provincial public health standards. These are the big, widely publicized acts of leadership. And then there are the quieter ones we can all reflect on as we say farewell. The time in his early years as a medical officer of health when Ezra returned to the office to support a team of nurses who were having difficulty locating a young mother in crisis. The time he joined an employee in the Community Cup soccer tournament for new immigrants to Canada. The reason why I get a little chuckle out of me is Ezra's favorite sport is soccer.
Didn't go well that game.
The time he led the conversation of an existing meeting room into a faith space to support the religious observances of a diversity of employees. Ezra supported employees in this way so that they could do their best work for clients across Ottawa. Ezra's leadership will be remembered by OPH employees, by partners, and by the community for many, many years to come. For that, Ezra, and for so much more, it is my honor to present with you the Certificate of Appreciation from the Ottawa Public Board of Health. Congratulations.
Well, it's not often that I'm speechless, is it? Thank you very much, Chair Kadri. This means the world to me, and your comments are extremely appreciated. Everyone's appreciation, as just expressed, is deeply appreciated. I have always said that nothing that I have done in this organization have I done alone. I've stood on the shoulders of giants, and it has been, every day has been a true privilege. This board is just phenomenal. We are the envy of the rest of the province. When I'm together with my colleagues across the province and I talk about our board, the commitment, the depth of understanding, the penetrating questions, but the support. It's truly a nuanced art that you practice in keeping us at our best and in ensuring that we do what we can to really optimally serve those that we're here for. I will treasure this for always, and I will treasure our relationships and the memories of our times together always. Thank you very much. Merci beaucoup.
just reminded I missed one important piece of the information on Mr. Ferguson, so I'll go back to that and make that announcement. Sorry, Mr. Ferguson. My apologies. Just got to flip through about 15 pages of Israel's recognition, so just bear with me. And what it is that Mr. Ferguson did make other contributions beside his contribution with the public health effort, has graciously agreed to accept this recognition on behalf of many of the Ottawa Public Health. And I would like to invite Michael to come forward, which is what Councillor Chernyshenko has done. And I thank you for your service to not only our community, but to the Ottawa Public Health and the rest of the neighborhood. Thank you very much, Mr. Ferguson. Thank you. Sorry. On with the agenda clearing to the members of the board. And I'll turn the floor over to Madame Secretary for the roll call, please.
Thank you, Chair. Member Chernyshenko?
Présent.
Member Fleury?
Ici.
Member Kapoor? Member Lakin? Member McKinney?
Present.
Member Pinel?
Présent.
Vice-Présidente Poirier?
Présente.
Chair Kadri?
Present.
Member Kakish?
Here.
Member Taylor?
Present.
Member Tilley?
Ici.
You have quorum, Mr. Chair.
Thank you very much, Ms. Blay. And moving on, the regrets were from Member Lakin for this evening. And I've also found out recently that Member Kapoor may be coming in for sure, but probably a little late this evening. Declaration of pecuniary interest, including those originally arising from prior meetings. Member Taylor.
Thank you very much, Mr. Chair. I, Member Mark Taylor, declare a deemed pecuniary interest on Ottawa Board of Health Agenda 20, Item 3, 2018 Draft Operating Budget for the Ottawa Board of Health, Document 1, Page 5, Cost Shared Programs Foundational Standards, as my wife is an Ottawa Public Health employee working in this area.
Thank you very much, Member Taylor. And you will leave the table when that item is discussed. Thank you. Confirmation of minutes of the meeting of October 30th, 2017 and November 14th, 2017. Can we carry those minutes? Received? Carried? There were 19 communication items that have been received and held on file with the Board of Health Secretary. Motion to introduce reports. Vice Chair Poirier, please.
Thank you, Mr. Chair. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, the 2018 draft operating budget for the Ottawa Board of Health report, and the update on dental services report be received and considered.
Is that carried? Carried. Thank you. And just with the indulgence of the board, the item number, okay, well, let's carry on with the consent first. Chair of the Board of Health verbal report, number 1, that's going to come. Number 2, the medical officer verbal health report is coming also. The draft operating budget for Ottawa Board of Health for 2018, which is item number 3. I'm asking the board's indulgence to see if we can move that item to the last item for this evening and then go to item number 4 for the dental health services. Is that okay with the board? Is that carried? Which item are you looking for?
This is the food safety.
Food safety? Okay, so we'll give you that opportunity. Is that carried? Have that IPD put as the agenda item? Carried? Thank you. Okay, so on the dental report, are we going to, anybody have any questions on that? Do we need to hold that report or can we carry that report? Carried? Thank you. So moving back to item number, first going back to information previously distributed, Public Health Food Safety Program, Ottawa Safe Trial Project, and New Ontario Public Health Standards over review. That was IPDs that were handled previously, so we'll come back to Councillor Fleury after on that second item. So coming back to the budget, draft operating budget for the Ottawa Board of Health, I would like to invite Lou Flaberia and Brenda to come to the table to do a presentation. Okay. I just wanted the two people to warm the chairs before they really have to explain the numbers, right? So going forward, I'm going to present my verbal report, and then we'll turn the floor over to the Medical Officer of Health for their verbal report. Good evening, and thank you very much for joining us. As usual, I will begin this evening by updating you on some of the activities at Ottawa Public Health since we met in October. First, in November, we were pleased to be part of a pre-screening of movie Wonder. The new movie speaks to bullying, kindness, and mental health, and is geared towards families. OPH was able to use the opportunity to promote positive mental health and shared resources related to bullying and suicide prevention. The movie can help parents have that talk and spark discussions with children and youth. The theater was packed, and we are very pleased to have been part of the pre-screening. If anyone in the community wants more information on resources related to bullying and suicide prevention, please visit havethattalk.ca. Also, last month I took part in the Community Kitchen Cook-Off launch for the Albion Hetherington Recreation Center Kitchen. OPH has been an active contributor to the revitalization project at the city, which has focused on the Albion Hetherington neighborhood. And Dr. Etches, along with Jillian McDonald, did participate, and Dr. Etches also participated in the design group for that project. At the launch, there was some friendly competition involved as Councillor Deans, the ward councillor for the area, Dan Chenier, General Manager of Recreation, Culture and Facilities, and myself that participated with 3 youths on each team. The Hetherington community to cook and prepare a soup and salad using the ingredients provided and greens from a garden tower. The launch was a great success, and I'm confident that this community kitchen will provide children and youth the opportunity to learn about creating healthy snacks and be actively engaged in their own health and well-being. Finally, I would like to share a bit of news with you. Earlier this fall, excuse me. Earlier this fall, Councillor Keith Aglai and I nominated Dr. Levy for a College of Physicians and Surgeons of Ontario Council Award. And this is a surprise to Israel anyways, because he has not been made aware of that. Not the first tonight. For those who may not be familiar with it, this award honors outstanding Ontario physicians who have demonstrated excellence and come closest to meeting society's vision of an ideal physician. Although Dr. Levy was not selected as a recipient, the submission certainly reminded us of the extent to which Dr. Levy demonstrates all of the characteristics of an ideal physician. Not only does he use his skills to improve health at the individual level, but he works tirelessly to improve the health of the whole population of the City of Ottawa and beyond. On that note, I would like to extend my thanks again to Dr. Levy for his unwavering professionalism and dedication throughout his years of service to Ottawa Public Health, and to wish him well in his next stages of his career. I would also like to welcome Dr. Etches to her first meeting in her new role as Acting Medical Officer of Health. I know the board joins in my pleasure in welcoming you, Ms. Vera, and we wish you all the very best in your new position. Congratulations. Thank you, Doctor. And for that award, I just want to recognize the efforts of Councillor Keith Eglai to help nominate for a doctor for that prestigious award. So having said all that, can we receive my verbal comments? Received. Thank you. Okay, moving on to the Medical Officer of Health for their verbal comments. So I'll turn the floor over to Dr. Levy and Dr. Etches, who will present verbal update and any questions that the board may have to answer. Dr. Levy.
Merci beaucoup. Thank you, Mr. Chair, and thank you for that information, and thank you very much to you and Councillor Eglai. C'est mon plaisir. It is my last opportunity to provide you with an update, as has been our custom at the opening of our meetings. And I think these updates have been very important from my perspective because they do allow us to have discussions that reflect the reality of the organization and the pace of the work that we do. OPH, of course, is very dynamic, and some of the emergent issues do move very fast. So I've always appreciated the opportunity to take this few minutes at the start of our meetings. Never in our time together have I felt so warm because you've certainly got the blood flowing this evening with your wonderful acknowledgements, and I'm sure I am blushing. I do want to note, of course, that we operate on the traditional land of the Algonquin Anishinaabe peoples, and at OPH we always try to remember and recognize that and be respectful of the social and historical implications, even, of course, as we look to the health and needs of all in the community. Since we did meet in our special meeting about a month ago, Dr. Etches and I have been working to ensure that my departure will be smooth and that there will be no disruption to services that OPH offers to the community. We've worked very, very closely on this goal, and as we have worked together for the last several years on all matters of interest to this board, and I'm confident that our community and our employees will be very well served as Vera formally assumes all of the work of the MOH. This will actually start in just a few minutes, as Vera has agreed to update you on the most pertinent developments of the last few weeks. So really what I want to do now is just take the opportunity to formally thank you again for your leadership, commitment, support, and wise stewardship over these last 3 years. As I said in my earlier comments, you've genuinely been a wonderful board to serve, to work with. You've enabled us to serve those we serve, and you've expected that we would operate in a way that would make a positive impact in the community. And I believe that we've done that with your leadership and support, and I'm very grateful for that and very proud of it. I also will take the opportunity to thank community partners and volunteers, our employees, our municipal partners, and also, of course, Ottawa's media, who I never know how to talk about Ottawa's media. They're not, of course, partners, and yet we rely on them in many ways to help spread the message that we need to, and they come through in a way that holds us accountable, makes us better, and helps us convey our message more often than not. So we're grateful for that. All of these players have helped make our organization stronger and more impactful than we otherwise would have been and could have been. But it would be remiss of me not to specifically mention our leadership team at OPH as well. These are the people that I work most closely with on a daily basis. And I can tell you, and I know you know it, the professionalism and skill of our leadership team is really extraordinary. It's been a pleasure working with each and every one of them, and their friendship has made it even more special and will be treasured. We do, from a substantive point of view, we do have a memo before you tonight regarding the new Ontario Public Health provincial standards. And Chair Kadri and I were in Toronto, as that memo outlines, just a few weeks ago for the launch of the provincial standards. And as anticipated, there is much in those new standards that we will need to be considering, or the team that will be working into the future will need to consider, as OPH rethinks its operational plans and rethinks the resources that will need to be deployed to address the new requirements at the same time as we also address the local identification of health needs in the community. So there is a planned course of action outlined in that memo, and I can assure you that the team at OPH is actively working with the new materials that we've just received and will be phasing in the requirements during the next year. Also, relating to the provincial health system transformation, after your discussions in October, the report that we discussed here that was titled Ontario's Health System Transformation, the response to the Minister's expert panel report, was forwarded to and ultimately approved by Ottawa City Council in November. And you will also have noted that there is no mention of the Minister's expert panel report in the new standards. At this time, we've also not received any further updates from the province as to its intention with respect to those new standards. So I think the discussion that was had around this table and other tables in health boards and municipalities across the province is clearly being heard, and the ministry is taking some time to think about that feedback. So, Mr. Chair, I'm going to ask Dr. Etches to take over the microphone now and continue with our verbal update. I will end by saying that I also especially want to thank Vera. Vera has been a tremendous support to me. She's a relentless activist for health equity and social justice. In all of the years we've worked together, she's really set the bar for our organization internally as well as for our community externally. And I wish you, Vera, and all of you the very best in your future. It has really been an honor to work with you, to serve in the capacity of Medical Officer of Health. I will be eternally grateful. Merci beaucoup to all of you, and of course I'm still here this week. So thank you.
Thank you all for your warm welcome in Israel, especially for your kind words. J'apprécie les messages de soutien que vous m'avez partagés au cours des dernières semaines, and I am looking forward to serving the people of Ottawa in this new role. Isra, on behalf of your OPH colleagues, thank you for your dedicated leadership and very best wishes with Canadian Blood Services. I too recognize that we're meeting on unceded Algonquin territory, and promoting health equity for First Nations, Inuit, and Métis people is important to me, to work in partnership. So I will take a few moments to provide an update on current developments related to opioids, cannabis, and then a few comments on the Auditor General's report that was released last week in Ontario. First, the federal government has now announced a new investment of $36.4 million over the next 5 years for public education and awareness related to cannabis. This is welcome news for Ottawa Public Health. As you know, one of our main concerns was the lack of public education about the health and safety risks of cannabis use, particularly for youth and young adults. On November 1st, the province tabled Bill 174, also in preparation for the legalization of cannabis. This bill received second reading on November 20th and is scheduled for third reading by the end of this year. Your recommendations from our last fall's meeting with respect to the legalization of cannabis included that there be no public consumption and that we put a focus on priority towards protecting the health of youth, given the evidence related to the harms of early and regular use. So Bill 174 appears to align with these objectives. It would repeal the existing Smoke-Free Ontario Act as well as the Electronic Cigarettes Act, and replace it with a new Cannabis Act, as well as a new updated Smoke-Free Ontario Act, and there'll be changes to the Highway Traffic Act. Notably, the bill establishes a monopoly over the distribution and sale of cannabis through enactment of the Ontario Cannabis Retail Corporation Act. So under the proposed legislation, the legal age to purchase, possess, and consume cannabis in Ontario will be 19, aligning with the age for alcohol and tobacco use. And the bill also proposes penalties for youth who distribute or use cannabis, and broadly prohibits the consumption of cannabis in public spaces, workplaces, on vehicles and boats, in vehicles or boats, and any place otherwise specified by the regulation. So staff will continue to monitor this issue and report back to you as appropriate. Also last week, the Minister of Health and Long-Term Care and the Ministry of Community Safety and Correctional Services released new data on opioid-related deaths and hospitalizations. They show the escalating nature of the opioid crisis. In the spring and summer of this year, compared to the same period last year, there's a report of 68% more deaths in Ontario due to opioids. As a result, the province is making naloxone available to police and fire departments across the province, and this is an initiative that Ottawa has already undertaken as OPH has worked in partnership with our city departments. Also related, the federal government recently granted the province of Ontario authority to approve supervised consumption services. However, we do not yet have the framework from the province for what this application process or approvals will require. At the local level, Board of Health members will have received responses to inquiries that were tabled at the last meeting in October related to our supervised injection services, and we'll have a full report on the evaluation of those services at our first meeting in 2018. So in addition, on opioids, we were very pleased to hear that the Champlain Local Health Integration Network has increased its funding for treatment for people who use opioids in Ottawa and the region. It's $1.7 million that the Champlain LHIN has committed in ongoing funding for a variety of health agencies across the region. And there will be a focus on rapid access to access prescription opioids that would address the use of street-level drugs. Moving to a different issue, Ontario's Auditor General last week released a value-for-money audit of public health chronic disease prevention. The report highlights the importance of chronic disease surveillance, of monitoring, evaluation, healthy public policy, and working with partners. Ottawa Public Health is in agreement with the importance of provincial leadership and opportunities for the Ministry, Public Health Ontario, and public health units to work together to address this area. While the auditor's report outlined some challenges facing some health units, such as with accessing schools, using epidemiological data, and providing program evaluations to look at the impact of programs, Ottawa Public Health continues to demonstrate strength and leadership in these areas. The auditor also highlighted the ongoing challenges experienced by some health units, including Ottawa, such as the funding inequities amongst local health agencies and the operational challenges with receiving our funding late in the year. In closing, board members may have noticed that the flu season is upon us, and while we have ended our community flu clinics, it is still possible to get the influenza vaccine through pharmacies or through local public primary care providers. So again, I appreciate the privilege of being able to provide continuity and consistency on these files. And Mr. Chair, that concludes my verbal update. I'm happy to answer any questions.
Thank you very much, Dr. Rakesh. And any questions or comments from the board members? No? Thank you very much for your presentation, both to you, Isra, and to Dr. Rakesh. Thanks very much. Can we receive this report? Received. Thank you. Moving on to item number 3, the draft operating budget for the Ottawa Board of Health. So I'll turn the floor over to Lou and let you walk through the budget with the board, please.
Thank you very much, Chair. Tonight I'm joined by Brenda from the Finance Department and by Madison, who will help with the slides. You will recall that when we tabled the budget with you on October the 30th, we communicated several avenues for residents and stakeholders to submit questions or comments on the draft budget. This included a dedicated email address and a telephone number. I can report that as of this afternoon, no communications have been received through either of these avenues. Tonight, as you consider the 2018 draft budget, we will provide a brief overview of changes since our last meeting. As we reported in an email and attachments that you will have received last Friday, the 2017 ministry funding announcement was received on November the 15th. It contained new one-time funding of $559,000 for initiatives pertaining to Indigenous health, immunization, Healthy Menu Act enforcement, and various other areas. At the same time, the ministry also reconfirmed a base increase of $350,000 for opioids, which had been announced in August. Ottawa Public Health's original 2017 submission to the ministry had requested a base increase of 2.5% on cost-shared programs. This request was not approved. The net effect of these announcements is an overall base decrease of $765,000 to the OPH budget. It is staff's recommendation that this be accommodated by reducing 5 FTEs through attrition and increasing the gapping provision by 0.5%. It should be noted that OPH is not the only health unit in the province to not receive an increase to their base outside of opioid funding. We have confirmed that 33 units received a zero increase to their base for cost-shared programs. Lastly, there are no changes to the 2018 assumptions, which include an increase from the city of $415,000 and an anticipated 1% increase from the province. Once the board approves the budget tonight, it will rise to council on Wednesday, December the 13th for final city approval and then be submitted to the Ministry of Health and Long-Term Care for consideration. We welcome any questions at this time.
Thank you very much for the presentation. And before I go to question, I'm going to ask Vice Chair Poirier to move a motion for the budget this evening.
Thank you, Mr. Chair. Whereas the Ministry of Health and Long-Term Care provided its 2017 funding letter to Ottawa Public Health on November 15, 2017, after the 2018 draft operating budget for the Ottawa Board of Health has been tabled with the Board of Health and with City Council, and whereas the above-mentioned or referenced funding letter confirmed a previously announced $350,000 increase to Ottawa Public Health's base funding for opiates and $559,000 in one-time funding for various programs and initiatives, and whereas the above-referenced funding letter also indicated that the anticipated base increase of 2.5% for cost-share programs for 2017 was not approved, and whereas the net effect is a permanent reduction of $765,000 to the OPH budget, which will be accommodated by reducing staffing levels through attrition and by a small increase in gapping provisions, and whereas the provincial funding letter does not affect the assumptions made in developing the 2018 draft operating budget, but does change the 2017 and 2018 numbers that are reflected in Document 1, and whereas staff has revised Document 1 to accurately reflect adjusted numbers, and whereas the revised Document 1 continues to be in line with the City's guidelines for budget development as outlined in budget directions reports approved by City Council, therefore be it resolved that Document 1, as tabled with the Board of Health on October 30th, 2017, and with City Council on November 8th, 2017, be replaced with the revised Document 1 as circulated to members of the Board of Health on Friday, December 8th, 2017, and be it further resolved that the revised 2018 draft operating budget for the Ottawa Board of Health be forwarded to Ottawa City Council for consideration on December 13th, 2017, as part of City Council's approval of the City of Ottawa 2018 draft operating and capital budget.
Thank you very much, Member Poirier. And is that motion carried? Carried. Oh, sorry. Go ahead.
Thank you, Chair. I just wonder what permanent reduction of $765,000, how many staff would we be looking at through attrition, roughly?
We're proposing 5 FTEs as being reduced from the count, which is about 1% of the roughly 500 that's part of the base.
And do we know where they're coming from? Like, is that...
Yeah, at this point, we don't. We're going to be reviewing it, and we're looking again, as mentioned, through attrition, vacancy, and we're not looking at affecting individuals. Again, we're taking attrition and vacancies as our principal.
Okay. And what is our current gapping at public health?
It's about 3.5%, and so this will add another half. So it's just under 4% that it'll bring this up to.
Do you know what the average is at the city for gapping? What's the
policy outlines 3%, but it can vary from department to department depending on their level of operation.
Okay, I mean, I can support this, but I think that we really have to think about, you know, going forward. It still is pretty significant, and I think a 4% gapping is still pretty significant. So I'll support it this time. I just to note that I do have some concerns with that size of gapping, and if in the future we don't see our base increase through the province, I want to see us as a municipality deal with that in some other way rather than just through attrition and gapping.
Thank you for your comments, Member McKenney. And in terms of going forward for next year or the year after, then we can look at that piece depending on what the impacts are of the funding from the provincial side. So, all right, thank you. So is the motion carried? Thank you. There's 5 speakers for this evening that I'd like to invite up front and have their presentation heard, and then we'll go to questions of staff. Okay. Our first speaker is Janice McFarland, Director of Mental Health and Housing Services for Pinecrest Queensway Community Health Center, and she's here to speak with us. Come on up front, Janice, please. Any one of those microphones. Thank you for joining us. Press the white button in front of you on the microphone, and you have 5 minutes to address the committee. Okay. Thank you.
Okay. I'm here to talk to you tonight about addressing the epidemic of bedbug infestations in Ottawa. Over the past few years, bedbug infestations have become a citywide problem affecting buildings, homes, residences, housing projects, shelters, and hotels, and one need only Google bedbugs in Ottawa to find a listing of today's reported infestations and addresses in the buildings. After a 50-year hiatus, bedbugs have been regaining prominence. Much more than simply an annoyance, bedbugs have proven to be an economic, social, psychological, and physical health impact on all the constituents of our city. Bedbugs don't discriminate. Bedbug infestations in Ottawa risk becoming chronic if left unaddressed. Ottawa needs a coordinated strategy in addressing this problem. Health, social services, housing, and legal agencies are exhausting their resources by using inefficient, ineffective, uncoordinated, piecemeal systems to try and address the bedbug issue. Meanwhile, bedbugs continue to spread. Be Big, which is a bedbug information group, it's a group of 35 agencies that have come together, recently formed, and it keeps growing. These are agencies whose work and budgets are directly affected by the bedbug infestations. It's not within their mandates necessarily, it's just affecting their work. The exact scope of the problem is something we've begun to track. At this time, the reporting is primarily anecdotal, as concerns are regularly voiced by family doctors, legal clinics, student unions, education institutions. Reports of infestations in Ottawa have become a daily phenomena, impacting tourism and the use of our public buildings. People facing infestations experience distress, severe anxiety, displacement, relocation costs, loss of belongings, loss of work, exposure to chemical treatments, and it's an extremely onerous process on any tenant or anyone who has to prepare for these treatments. And quite often the treatments are unsuccessful. Some people have been unable to access their health and home care services because providers will no longer go into their units or homes. Service agencies are reporting a significant increased diversion of funds and human resources to deal with bedbug issues, depleting the resources that were intended for other frontline services. Landlords are reporting that bedbug treatments have been gutting their maintenance budgets over the past few years, mostly because of a lack of coordination of treatment as well as a lack of reporting and cooperation on the part of the tenants, who often don't want to report that they have bed bugs or they're in the surrounding units. For families and individuals who are vulnerable, financially disadvantaged, overwhelmed, afflicted by mobility issues, mental health or addictions issues, or they're unable to cope without further supports. Supports are rare and difficult to get to help them prepare for dealing with infestations. The fear of stigma and the work required to prepare for bed bug treatments is enough to keep tenants from reporting them, which often compounds the problem. Consequently, a growing demographic of people are finding themselves in emergency homeless shelters, relocating, couch surfing, being evicted by landlords and not-for-profit housing sector alike, are repeatedly failing to report their units have bed bugs.
You have 1 minute left.
Okay. I'm going to skip some of this. We know a lot of it. What essentially we're looking at is there was public health dollars in 2011, 2012. Those dollars disappeared. It said that it was addressed or they just finished. Bed bugs haven't gone away. We're dealing with them every day. What we'd like from public health and the city is a mechanism be put in place to measure and track bed bug infestations in the city, the development of an appropriate strategy to address bed bug issues in Ottawa, a coordinated approach in implementing solutions such as there have been in other cities like Toronto and Hamilton, and ongoing financial investment to ensure the efforts are supported over the long term. So I'd be happy to answer any questions that you have.
Thank you very much, Ms. McFarland, for your presentation this evening. Any questions? Member Taylor?
Just to clarify, Mr. Chair, is this questions to the delegation or to staff as well?
You can do both.
Thank you very much, Janice, for your presentation and for your submission. And I know that I think the memo back from Dr. Etches was circulated to committee before. But I know that the funds that originally came through in 2011, I believe they came from a provincial funding announcement of a fund of $5 million or so. And my understanding with the fund was that in virtually everywhere in Ontario except for Toronto, once the funds were expunged, they were gone and there was no additional funding. But Toronto's funding was made part of its base budget from the Ministry of Health. You know, last week I spent some time, it's interesting that Janice raises the shelter. Last week I spent some time at the Salvation Army shelter, and one of the things in the intake process that we discussed in the why do people show up at the shelter, one of the issues that was on the list was bed bugs. People are showing up at homeless shelters because their apartments, their homes are overridden with bed bugs. Currently, the funding that we have, as I understand it, goes to our own housing agency and goes to Ottawa Community Housing, who has an integrated pest management strategy. And I know Councillor Fleury and Mr. Giguère at Housing have been very diligent about that. That's only one piece of the puzzle in the city. So I'm wondering, Mr. Chair, given our budget constraints, if, you know, with your support, I'd like to put forward a motion that we at least engage the province, write to the province, that the Board of Health approve writing to the province and asking for sustained bed bug funding along the lines that Toronto gets. You know, I think if we don't ask, we might not get, and the province seems to be in the mood to fund specific line items but not general expenses for public health, so why not come back and start articulating some of the need to them. So I'm happy to write that motion up or put it on the floor for discussion.
Thank you very much, Member Taylor. Now, did you have any questions of the delegation?
I don't. Thank you.
Anybody else have any questions? Member Fleury?
So I fully agree with the delegation and my colleague. I would add further, though, that if we don't want it to be piecemeal and a response, currently bylaw services is undertaking a full review of their services. And I view bylaw as, frankly, a part of the problem, because they only support those who are organized and active, but as the tenant might move out because the landlord is poor reaction, then the next tenancy might be as vulnerable. So I'd love if for us we were to, as Ottawa Public Health, not only ask the province for sustained budget funds, but also on a more operational basis be part of the bylaw review. And these are the operational review from bylaw services, and find a mechanism so that we close the loop on that gap.
Thank you very much, Member Fleury, and I'll let Dr. Etches respond to both suggestions or questions.
Sure, and thank you for bringing this issue to the table. It is a concern. We know it causes distress. Our team has looked at the model in Toronto and would be very interested in talking with partners, including bylaw, about what could be done with a sustainable source of funding. So I would welcome that.
Thank you very much, Dr. Etches. And so, Member Taylor, you're putting the motion on the floor?
I am writing it as we speak. So that the medical officer of health write on behalf of the Board of Health to the Ministry of Health and Long-Term Care to request sustained bedbug funding, sustained funding for addressing and remediating the bedbug issue in Ottawa, and coordinating with our other City of Ottawa staff to ensure that an all-encompassing approach is taken to addressing the issue. And I'll try and remember that as I write it down right now.
Any questions on the motion? Dr. Etches, did you want to make a comment?
We would certainly be working with community partners as well.
There are 35 agencies ready and willing to work with you. Thank you.
Any other comments or questions?
So do I need to put a motion to mine, or is that a direction to staff?
I think Member Taylor is going to put it together. Okay. So, yes, Member McKinney.
So do we have any idea what the cost would be, what we're asking for? I just see that we're $700 and some thousand short already, and I'm just not sure if we're not just kind of pushing this off the agenda here.
I believe the program in Toronto is a $1 million program per year. And we don't have any current funding for bed bugs in our budget, apart from part of the public education we do in our courses service.
Okay, so half of that, maybe 500,000 is what we're asking for. Do we have any idea what we're asking for? And just how do we really expect to get that extra funding from the province? The reason I'm asking is that because we do have a budget coming up in 2 days, and we are moving into 2019. As Councillor Fleury mentioned, bylaw is undergoing a review of their strategy, but that's for rooming houses in particular. So I just wonder if there's something more that we could be doing rather than simply writing to the province.
Thank you, Member McKinney. Did you want to respond to that, Member Taylor, or are you looking at a specific dollar amount through the motion?
Well, I'm looking to our staff to guide us with a particular dollar amount. I know that when Councillor Eli Kakish and I had a budget forum, a city budget forum, one of the pieces that was actually brought forward to us by the public was funding for bed bugs. So I'd look to our staff to quantify it with a number. Certainly, I'm sure if they go back to look at 2011, they can look at what was the funding that we received. Is that amount of funding commensurate with the outcomes that we're looking for? A coordinated strategy, as the delegation is suggesting we should have. So I'd let our staff put a number to it, given that it's not affecting our budget. I think if Councillor McKinney's looking for internal budget monies from the city to come to OPH to fight it. I mean, I'd welcome that discussion during our budget debate at the city, but let's start first by going back to the hand that originally declared a bedbug crisis and sent us a one-time check.
Thank you very much, Member Taylor. Member Rakesh.
Thank you, Chair. And I just had a question because this came up last week as well at the Community and Protective Services Committee. And when I asked the question on it, my understanding is we do give kits as well. It's not just an education campaign. I don't know if that's under OPH though or under Community and Social Services. So can you elaborate about that in terms of what we hand out to the public and where that budget is coming from?
Yes, so we don't directly, as Ottawa Public Health employees, hand out kits. We counsel people on the steps that are needed to address bed bugs, and it's through community partners that those supplies are used. We have been able, through our partnership with Ottawa Community Housing and the Community and Social Services Department, to at times through our partnership add to their resources to be able to do that work.
Okay, and so that funding, is it specifically, I'm assuming, so of the 93 or so agencies, I assume a small number of them, you said 30 or so, some of the funding, I guess, that goes from the $23 million to the various social agencies, some of that, I guess, is used. So how are you using that money? Can you explain to me where or how you allocate the funds for the kits if you're handing them out to clients at the moment?
So I work in a public health center. We have housing agencies that we work with, some of who are here tonight. They receive money from the City of Ottawa, and I believe it's about $100,000 through public health. Some of it comes through housing as well, and that's for covers and information and the things that you put under the sides of your bed, which doesn't even begin to address the issue.
Mm-hmm. So the longer, in terms of eradicating it, what exactly, how would you do that? Because how do you deal with it? So how does more money resolve the problem if the kits don't resolve the problem?
I think the kits are a piece of the education. I think everybody coming together and talking about, finding out what the best practices are around the world, quite frankly. We had put together a small proposal to try and get funding to even tap into that research, and the number we were asking for was $100,000 to begin to even look at how do we begin to address this. But just someone to coordinate it would certainly help, because there are many agencies spending money just doing ad hoc here and there, often helping the same people. Ottawa Housing has a really good program. They're a good place to start. I'm not sure what their budget is, and expanding that program would certainly be a start with public housing. I know with the Private Landlords Association, there may be many other ways, such as tax breaks and bigger things. We don't have a distribution of dollars that come regularly to help with bed bug elimination at all. Mm-hmm. And I don't have an answer scientifically as to how you would eradicate them.
Yeah, thank you. So, I think Councillor Taylor pointed out, and I think Councillor Egli, communicated to you when we had our budget meeting a month ago, this issue came up, and it certainly came up last week, although, so I agree with Councillor Taylor, but I think Councillor McKenney makes a good point too. I think there's several departments that overlap in terms of the work that's being done, so perhaps we can go back and get some clarification on what exactly is being allocated towards that from Community and Social Services, and maybe some discussions between OPH and Community and Social Services staff happen before we send any kind of letter, so we have more concrete information to in the ask for the province. So I don't know if that can wait for, I'm not sure how time sensitive it is, so perhaps it can wait even till the next board meeting, or if we can get it by council on Wednesday, that would be great, but if not, then we can just do it whenever we have the information available.
Yeah, we can take that as direction. We are in conversations with all the other relevant city departments. So
yeah.
Okay. Member Fleury.
Mr. Chair, just as a chair of Ottawa Community Housing, I know that delegation did speak to Ottawa Community Housing's efforts in that regards and some of the leading technologies through the pest management group. A few years ago, I had the opportunity to go to a conference in Vancouver on the matter. And there are a few strategies that we could adopt very quickly that would support our most vulnerable. And obviously it starts with having a prepped unit and making sure that the neighboring units aren't infected. But then after you have a full building where you've gone through that way, the new buildings in the west coast of our country have either a cooling or a heating room. So as clothes and furniture comes in for the building, everything is all the bed bugs are killed through those purchases. One way that Ottawa could do it is purchasing a van where we can move from property to property and work between public and private landlords to bring in those strategies. So there are options. Some of our partners are informed of them, and certainly if the province wants to be part of a more sustained discussion rather than I think the kits help, but they're really just a Band-Aid. We have knowledge, and other providers in the country and in the city are willing to have a more cohesive strategy.
Thank you very much, Member Fleury, and I think you're absolutely correct that in terms of a comprehensive plan, you have to look at other related issues or other municipalities that are already, participating in this kind of program. But I think the first step that Member Taylor is suggesting is at least approach the province to see what the buy-in is for some kind of funding. And then once that happens, and some of the departments that Member McKenney mentioned in the city, Ottawa Public Health, as Dr. Etches just mentioned, is already involved in those processes. How far can we get involved, I guess, depends on the money that comes in from the provincial side. Member Poirier, please.
Thank you, Mr. Chair. I was just going to suggest that in looking at Toronto, you can look at what the $1 million is allotted towards and see what has been successful there. But I think that's for staff to figure out too.
Anyone else? Any other comments? If not, so Member Taylor hasn't written the motion up, but I think the general senses of the motion is there. It's coming. Okay, so we'll wait for the motion to come. Thank you very much, Ms. LaFrance, for your presentation, and thank you for being here this evening.
Thank you.
Appreciate your participation. So while we're waiting for the motion, what I'll do is I'll call the next public delegation, Katrin Dahl from Rideau Rockcliffe Community Resource Center, and Linda Giffen from Sandy Hill Community Health Center, and they're both representing Good Food Initiatives.
Good evening, and thank you very much to the members of the board for hearing us this evening. My name is Linda, and this is Katrin, and we are both with the Coalition of Community Health and Resource Centers, and we are today in our capacity today as co-chairs of the Good Food Initiatives.
So the Good Food Initiatives are the 3 coalition-based food programs that support access to healthy, affordable, and culturally appropriate food for our communities in Ottawa. We've been working together in partnership with Ottawa Public Health for a number of years. And we're here today not only to say thank you and celebrate the success of that partnership with Ottawa Public Health, as they have directly supported the work of the Good Food Markets, the Market Mobile, and the Good Food Box for over 5 years, and I believe much longer than that with the Good Food Box. So we want to recognize and appreciate that piece, as well as say thank you for continuing to do the good work with the Nutritious Food Basket information, which is a very strong advocacy tool that we use in the community. I personally use it in almost every grant application that I write, which is quite a few, and it shows the strong link between poverty and hunger and food insecurity. So thank you for that. And we're here to ensure that the good food initiatives remain on the radar of Ottawa Public Health and the Board of Health, as we have experienced less participation as well as support in recent years. And we want to remain partners as we grow and evolve these important programs.
We know that food insecurity is a serious public health issue. The City of Ottawa's own nutritious food basket data, as my colleague mentioned, details the poor health outcomes for children and for adults that include increased incidence of both poor mental health and physical health. Food insecurity also makes managing chronic disease through diet more challenging, and this leads to higher healthcare costs. You guys are telling us that 1 in 15 Ottawa households report being moderately to severely food insecure. And we know that at highest risk within this group are people on low income and newcomers to Canada. These are our most vulnerable people. Your own data from the Nutritious Food Basket is telling us that food insecurity in Ottawa is a public health concern.
So given this, every year we evaluate our programs and we hear directly from our communities that 80% of people who shop at the Good Food Initiatives eat more healthy food directly as a result of participating. 81% report that the Good Food Initiatives are more affordable than grocery stores that they are accessing. People come to the Good Food Initiatives because they are close to their homes, they save money, and feel more connected to communities. People, when they access our programs, they feel welcome and respected. And we know that over 64% of participants earn less than $34,000 a year. So we're really hitting that target group of people experiencing poverty, and that's directly linked to food insecurity. So once again, we're here today to encourage Ottawa Public Health to continue to support access to healthy food through place-based community food programs with both in-kind resources and funding. We know that place-based food programs won't solve the problem alone, so we ask that Ottawa Public Health continue to be involved and play an active leadership role in building a larger food strategy around food and income security.
Now, it's one thing for us to speak, but we know it's another thing to hear from residents, and it's another thing to show that, for residents to come and show that they care. And you'll notice today that there's green and red aprons that have come out here. These are all people that are positively affected by the Good Food Initiatives, and it's something that's important to them. And I know we have a couple of them that are coming and willing to speak with you today. We hope that you will hear them as well. And we thank you very much for your time and your consideration.
Thank you very much, Ms. Dole and Ms. Giffen, for your presentation. Any questions from the board? Seeing none, thanks for attending this evening and doing the presentation. Our third speaker is Janelle Vandergrift, Community Health Promoter from Somerset West Community Health Center, and she's here to speak with us about food security issues.
Annie. My name is Michelle Penny. I'm actually Janelle Vandergrift's employee. I work for her. I work for Somerset Community West Health Center, and I also work, I also am a resident within the area that I work. I'm a community developer, and I am part of the community development work in Mechanicsville. So. I work at the health center, community health center at 30 Rosemont Avenue, and the past year I've been involved with the Market Mobile, which came every Thursday from 5 to 6 until about a month ago, and now comes every other Thursday from 5 to 6:30. Mechanicsville is an area that has two businesses, a local corner store and a pizza shop across the street. And the closest grocery store is Metro and Superstore on Richmond Road, which offer delivery of groceries at a cost, or Farm Boy in Westboro area, which offers no delivery. There is a Market Fresh store in the Hintonburg area. However, that store can be quite pricey for low-income people. Also, Mechanicsville has 5 buildings that deal with low income specifically or are affiliated with OCH, and the distance to get to those stores is a bus ride away. I stumbled across Market Mobile over a year ago via email. It was a very intriguing email that caught my attention, and it probably took me a month to actually make it there. Surprisingly enough, the vehicle was parked down the street from me. I remember seeing the prices and working out a budget for when I went there. I took $50, a wheeled cart, and an extra cloth bag. I was greeted by a volunteer who recognized I was new to the experience and explained to me the process. It still gives me pleasure to tell others that I am their personal helper as they shop today. I filled that cart and the cloth bag, and the cost came out to be $35. I was stunned. I ran home to show my family, and they couldn't believe the cost of all of that either. It would have cost me a lot more in a grocery store, and to tell you the truth, I probably wouldn't have bought as much as I did had it not been the Market Mobile. Everyone has a right to healthy food. Some places are not as easy to access healthy food as others, and Mechanicsville is one of them. If a person is disabled or without the ability to afford a bus pass to get healthy food, it is an empowering experience to be able to find that access within their neighborhood. There are many pluses for this service. I met people in the community that I would not have met anywhere else, as there are not a lot of events held in Mechanicsville area. The savings on the food is phenomenal. The convenience and consistency of times, of the times they are around, is so appreciated. The emails and reminders are an awesome bonus. Market Mobile allows for other services to be introduced into the area also. So at the same time, we could have our public health nurse come out and promote whatever it is that needs to be promoted at the time. We can have a number of any services that come out there because we know that they're going to be there at that particular time. And that helps because that also encourages them to come out to the Market Mobile if they know there might be something that they may be able to learn about accessing also. Market Mobile allows for to talk to each other and to find out what the community wants to see happen in the area. We give updates, give information, and just remind the residents of Mechanicsville that Somerset West Community Health Centre is present, aware, and listening. It's about building a community, and that's a lot of been my job my whole entire career. I've dealt with the homeless, I've worked in the courthouse, and now I'm doing community development. And it shouldn't have to matter who's sitting in these seats of power, I guess you could say, that are around here. It should not matter. It should be about the people. That's who you're representing. And this is one service that does represent the people. It allows them to get food at an affordable price.
Ms. Vandergriff, you have 1 minute left.
That's cool. I'm done. But I just wanted to let you know that they spend so much time begging for money, for funding, when really they could be working a lot more time at providing the services that we need in this city. Miigwech.
Thank you very much. Any question of the delegation from the committee? Member Rakesh?
I wasn't sure if I missed, was there any particular ask? Are there any changes to the Market Mobile from OPH's perspective, or was it just the contribution of the initial bus? Or
I'm not sure what the particular ask is either, but I can say from the Ottawa Public Health point of view, the last time we invested financially in the Market Mobile was to look at the development of a sustainability plan to try to help the Good Food Initiatives come together and look at benefiting from a consultant to make some recommendations. And I believe those recommendations have come through. There are about 9 of them that I've looked at, and I think that our team is planning to be part of the discussions about how to go forward with those recommendations. So our team is certainly interested in hunger in the community, right? And we are not abandoning this issue, food security. We're interested in whether we can learn from what's happened and think about a sustainable approach, an approach perhaps that covers more territory and looks at all areas of our city. So I've been in touch with Yakuba, who's one of the leads for the community health centers, developing new approaches, as well as the executive director for the Ottawa Food Bank. And I understand there are some interesting new ideas to develop, and our team is looking forward to having more conversations about what's possible.
Okay. Did you have anything else you want to add, or any specific asks? Or?
Just being a community member too, I do know of Mechanicsville, I do know the importance of it. And as I walk around the community, we're working at ways that we can get more people to come out there because it's an initiative that's in the area. But I'm sure because each area is now kind of being gentrified to a certain degree, and I'm sure there are people there that think it's only for low-income people when it's there for everybody. It's not just for low-income people. It does target the low-income people to make it affordable, but it's also there for those that make $100,000 to $150,000 a year also. If it's going to save the money, that's what counts, right?
Absolutely. Okay, thank you.
Miigwech.
Thank you very much, Member Kakish. Anyone else? Thank you again for your presentation this evening. Thanks for joining. Well, Councillor Chernyshenko.
I was just intrigued by that last comment. So in terms of how it works, I mean, I suppose I suffer from the stereotype that many do, that this is a program that's specifically aimed at the people who need it as opposed to could afford to go shop wherever they want to. Is there any benefit to someone who has the means to shop anywhere shopping there? Does it in some way help to subsidize, or might it be seen as taking away food and time and energy from those who may need it more?
No, we encourage everyone in the whole community to come if we can. It doesn't matter how much money you have. I find that the people that have more money than the low-income people, they make a heck of a lot more donations to the Market Mobile out of their own pocket. So if there's any guilt felt, then that's how they assuage their guilt, by putting in donations, you know.
Right. But it's not as if I went shopping, I would be deprived by walking out with my 2 grocery bags. I'd be depriving someone who may have needed it more than I did.
You will get the same service as everybody else, and at the end, all of that food has to be gone off the truck by the end of the day. So whatever's left over and whatever is there, that's what is available, and as long as they don't have another stop to go to, we benefit from it because we get to buy more sometimes.
Very interesting. Thank you.
Thank you very much, Member Chernyshenko, and thank you again, Ms. Vandergrift, for being here this evening. Miigwech. Our fourth speaker is Rakesh Mishra. He's a volunteer at Market Mobile, and he works with the Market Mobile. Good evening, Mr. Mishra, and
good evening,
you have
Mr.
5
Kadri.
minutes to address the panel.
Okay. My name is Rakesh, and I'm here. It is my privilege to be here to support the Market Mobile, both as a volunteer and as a customer. My relationship with Market Mobile began when I was living in Bayshore, where incidentally I voted for Mr. Taylor. I just thought I'd throw that in. And while living there, I needed to travel all the way to Lincoln Fields to get my groceries, which is a fair haul. And being a vegetarian, fresh produce is an integral part of my diet. Then I discovered Market Mobile in my neighborhood. 3 blocks from where I lived, suddenly I could access everything I needed that I had to travel to Lincoln Fields for. My load didn't get any lighter because for the same $10 I spent at Farm Boy or Metro in Lincoln Fields, I was getting twice the amount, or at least substantially more, buying stuff at Market Mobile. What really fascinated me is how my diet changed, how my habits changed. Because suddenly, instead of carrying a 10-pound bag of potatoes, I had room in my backpack and in my wallet for buying mangoes and grapes and green pepper. I was eating foods I'd never eaten before. I was suddenly eating kale and Brussels sprouts and mushrooms and mangoes. And I was cooking crazy things. I was cooking kale and potatoes and tomatoes and with cinnamon and cardamom and cloves. And I was making spicy tomato sauces and rolling them into a lasagna. It is like suddenly there is no beans and rice for this boy anymore. I was eating really well. And this youthful glow you see on my face, it belies my age because of the fine food I've gotten from Market Mobile. That's my experience as a customer. As a volunteer, I've been a volunteer with them now for almost 2.5 years. I have traveled with them to 8 different communities, seen 8 different markets. I have sold bags and bags of potatoes and onions and carrots and grapes and green pepper and red pepper and coffee. I've even sold a bag of grapes to Mr. Flory. Vote. I've sold stuff to students. I've sold stuff to young professionals. I've sold vegetables to retired people. I've sold vegetables to people on limited incomes. I have helped parents bring in their strollers and with their children and shop there. I've helped young parents bring in their kids, and the kid says, "Hey, Dad, can we get strawberries?" And Dad says, "Sure, let's get strawberries." And then he'll say, "Why don't we get some oranges too?" It's a phenomenally wonderful experience. But let me tell you 2 stories that have touched me most. There's one customer who came in. He's been coming in for a while. He's in his 50s. And he came in and he said he'd been to the doctor. And the doctor had said he either had to make some health choices or have the option of surgery. He said he decided to try the health choices because Market Mobile was there. Every week on his street, a couple of houses down from where he lived, Market Mobile would drop there with like 30 kinds of vegetables and fruit. And it was an easy choice for him because suddenly there was good health staring right in the face once a week, every week, as he looked out his door. That's what makes this thing incredible. My second example is of this other customer. She uses one of those electric scooters, and I've seen her all over the place. I've talked to her on Parliament Hill. I've waved to her at Chinatown. I've stopped and talked to her near Dow's Lake.
Mr. Mishra, you have 1 minute.
All right. This woman says she shops at Market Mobile because it's accessible to her, especially in the winter. It's important that she have a place to go to buy fresh produce in the winter. And that's what makes this place incredible. I walk all over the place. Ottawa is a beautiful city. Initiatives like Market Mobile and Good Food Initiative make it an incredible place to live. And welcome, Dr. Rakesh. We look forward to your support. I hope you'll support us. Ms. Blaze, thank you for your incredibly long hours because you responded to my email at like 7 o'clock in the morning. So thank you for that. And thank you.
Thank you very much, Mr. Mishra, and thank you for your volunteer efforts in the community, both with Market Mobile and your other projects that you do work with. Any questions from the members of the board? Seeing none, thanks again.
Thank you.
Our final speaker is Dawn Lyons, Director of Community Services for Pinecrest Queensway Community Health Center.
Hello. As a health-focused organization, we at Pinecrest Queensway Community Health Center share your vision to inspire healthy eating, active living, and strong mental health in our communities. I'm here today to speak about the need for community health resources in the Bayshore neighborhood. Bayshore is a culturally diverse rental neighborhood that's home to approximately 8,000 residents. Compared to the city as a whole, Bayshore residents face many risk factors, including a significantly higher percentage of children, youth, and adults living on low income, a higher percentage of people spending 30% of their income on shelter, a higher percentage of lone parent families, and a higher percentage of unemployed people. This vulnerable neighborhood was shifted into our catchment area 10 years ago with less than $25,000 to support community development and health promotion work. In an effort to have at least one full-time staff in the neighborhood, we've been operating on short-term funding for more than a decade. During this time, we've submitted more than 30 funding applications and have been successful in leveraging project funding from diverse sources. Using this model, we've been able to engage residents and to identify priorities and address neighborhood needs. This work has resulted in many positive initiatives, including establishing a community garden and collective kitchen to address food security, successfully advocating for a local grocery store to increase access to affordable food, and establishing an outdoor bake oven to bring residents together to build community cohesion. Yet despite these and other important advances, we've been unable to secure sustainable funding to keep this essential community development work alive. At this point, we're unable to identify any other sources of funding to support this work and are deeply concerned that without adequate staffing, we're at risk of losing the momentum that has been created through our efforts to date. Staffing is also required to strengthen our capacity to outreach to and offer community-based programming for those who are most vulnerable, including children, youth, newcomers, isolated seniors, and families. Last year, we were successful in securing an additional $9,000 through the Sustainability Fund, bringing our annual renewable city funding up to just over $36,000. Unfortunately, this doesn't even fund one full-time position. To effectively serve this community of 8,000 residents, we require at least one full-time and one part-time staff, along with some basic operating dollars to pay for travel and program supplies, a total investment of approximately $109,000. Unfortunately, we know our situation isn't unique and that there are many other organizations that face major gaps in responding to community needs. For this reason, we joined the 80 agencies with the Making Voices Count project to ask for a long-term sustainable investment in social infrastructure that responds to the growing needs and disparities in Ottawa. I'd like to acknowledge and thank Councillor Taylor for the significant support he has provided to the community of Bayshore over the years, including the recent beautiful renovation of the community's field house. I'd like to now introduce Mette Pamir, a community leader from the Bayshore, who will speak to the impact of the work in the neighborhood.
Mr. Mayor, before you start, you have a minute and 20 seconds left.
Oh, I'll try to be very quick, though it's a bit longer than I expected. I'm here to share my experience as a community member and organizer. For the last 6 years, I have been volunteering in community initiatives facilitated by the health promoters from the PQ Health Center. Through these years, I have witnessed firsthand the positive impact of resident involvement in our neighborhood, such as the good food initiatives, including our good friends at the Market Mobile, the establishment of the community garden and the community oven, all initiatives supported by health promoters. In all of these, the work of the health promoters has been essential in coordinating the core group of volunteers and ensuring the continuity of connections among the community at large. And I can attest to the ripple effects of this work in bringing the community together and boosting the well-being of residents, both on a personal level and on the level of a vibrant community life. A takeaway I would like to bring to board's consideration is that without the work of health promoters, the potential of the volunteers could not have been unleashed. And looking ahead, support in the promotion work would multiply the capacity of the volunteers in Bayshore. And I'm making this observation based on the conversations with my neighbors at our events, as well as based on the metrics we have been keeping at garden and oven activities for the last 3 years. Thank you.
Thank you very much. Any questions or concerns or comments from the board? Member Taylor.
Thank you very much, Mr. Chair, and thank you very much, Dawn and Larissa and Mette, and I see Charles is here as well. Thank you for coming out and offering this deputation tonight. I think PQ's on a roll. You've got 2/3 of the delegations here tonight. I just wanted to share with committee the incredible amount of work that has been done in Acora Village. It's a community of 8,000 people right around Bayshore Mall. For those of you whose minds go back this far, it is a former CDF neighborhood, Community Development Framework neighborhood, right, which kind of articulated at-risk communities and set about looking at strategies to address them. one of the things that was identified years ago was the lack of kind of appropriate infrastructure for gathering spaces, programming spaces, those types of things. So, so collectively, a whole hodgepodge of partners, not limited to Fergus Lee, who owns the residential property around there, our government, the municipal government, the federal government, even the Bayshore Mall and Pinecrest Queensway and some of its community health partners, other partners as well, have invested an incredible amount in trying to bring up the assets in the area to a place where they can serve the residents. So I think Don mentioned the community garden, which has been since expanded twice. Bayshore is one of the stops in the Market Mobile, which we just heard the previous delegation speak to. The outdoor bake oven, the first in, I think in the city of Ottawa, is in place and is a great community gathering point. And Ottawa Public Health was tremendously supportive and helpful in making an outdoor bake oven work from a health protection standpoint. The park has been renewed, and as Don mentioned, the field house was just renewed with partnership funding between the city and the federal government and was opened this weekend. One of the asks in the renewal of the field house was that we have gathering space and office space in there to provide community health programming and community partner programming. So I'm pleased to say that space is there now. So all of the conditions are there. We've built the infrastructure. Now we just need, we've invested in the bricks and mortar. We just need some help with the people side of the equation. So, you know, understanding again the constraints that our budget is under, and of course taking into account the ask for 1.5 FTEs or funding for 1.5 FTEs, I'm wondering, rather than asking committee to support that, Dr. Etches, if you would be willing to take it on yourself to kind of enter into some discussions with PQ about how you could help see a community health promoter or community health promotion start to take place in the spaces that we've now built.
Through you, Mr. Chair, I'm certainly always interested in learning from community models where you've been able to build on your strengths, and so I'd be happy to meet with people and hear more about what options are. Thanks.
Okay, all right. Well, I thank you for that, Dr. Etches. So we'll continue to leverage you then as the months go forward, and look forward to brokering a bit of a partnership with PQ to see how we can help deliver health programming to people in Bayshore. Thank you.
Thank you very much, Member Taylor. Any other questions or comments for the delegation? Seeing none, thank you again for coming in this evening to present. And with that, that was our last delegation for this evening, so I'll turn the floor back to the board for questions of staff on the budget, if there are any. Yeah. Sorry, Member Fleury.
Thank you, Mr. Chair. I do have a few questions. My first one is basically a general comment that I know that the majority of our funds come from the province, that Ottawa Public Health does tremendous work on a very lean budget, so I want to preface any of my comments and questions with those key elements. My first one is on page 7, which is the adult dental program. It's funny because we had a report that we approved just before, but I've seen the tremendous work that our Healthy Smiles clinics have been doing. I just want to ensure that the reduction of $40,000 does not impact the level of service that is so precious to our vulnerable residents. And before I go into and let our team answer, I just want to put additional context. When you're faced with financial variabilities, might be with unemployment, we know how important having a healthy smile can be. Having the ability to eat properly, to smile, to speak, and how that can be important for kids, for adults, and for seniors. So I just want to ensure that as part of this budget, we're not seeing a shortage in our opening hours, in our staff, so that we're going to be able to offer the same, if not more, services to very vulnerable residents in 2018?
Yes, so the quick answer to that is yes, we're able to offer the same level of service, and Mr. Lou Flebore was able to answer more detail.
Through the chair, that 40,000 is just a recovery of where we're being funded for our compensation increase. So it doesn't, it's not a reduction. The recovery and allocations lines are negatives anyway. So it's just where the funding's coming from.
Perfect. I just wanted to put it for record. I think it's important to, it's such an important program. Then I'd love to hear from you on the opioid response. So I'm not seeing as much. We're all saying there's an opioid crisis. The province has identified emergency funding. I'm not seeing that filter through into our 2018 budget. Is that because we're just unaware of those funds, or are we able to build up to respond to some of the community demands? Is, I guess, my key question for this year's budget.
Sure. So we did highlight that $350,000 were received in 100% provincial funding. That's in our base figure now for 2018. So it doesn't stand out as a line item, but that's part of the investment that the province is making, and that's coming to us directly. That money we are using in a few ways, primarily focusing on work to prevent substance use among youth and to help youth and young adults with addressing their substance use in schools and in community-based places, working with partners. It's also what's supporting our early warning system and our surveillance to know what's happening on the ground. And that's through collaboration, again, with partners, as well as distribution of naloxone. That funding beyond that that we do anticipate receiving from the province to address the opioid crisis will be for the supervised injection services that we're operating at Clarence Street. We just haven't heard a final answer on that figure yet. So that would be additional investment. And then not for us, but for the community, we are pleased to hear about the $1.7 million going into the treatment sector. And there would be other investments the province is making in other community partners providing service, but those are the ones directly for us.
Thank you. And for that, is it possible at some point when we have that relevant information from the province to share with the board a memo or an IPD, not only on the funding portions, but also as the response to my inquiry was submitted relating to treatment? I know that, as you said, there's some funding coming, but I think for the board purposes, you know, how many beds in Ottawa, and what's the at that time those beds should bring us to what sort of waiting list? I find sometimes it's hard to pull it all together, and even in a snapshot. So maybe as a takeaway, maybe not for today's budget item, but as we walk through some of the provincial dollars that are going to come in to our community, maybe related back to the board in terms of what does that mean from a community standpoint.
So I appreciate your interest in that picture. It's hard for us to speak to the details because that's funding administered by the Champlain Local Health Integration Network. However, it would perhaps provide a more fulsome picture if we could get more information from them about that investment. Since we'll be speaking about the opioid crisis in February, perhaps I can take it offline to see if we can have them provide an update.
Excellent. And my final question is around the smoke-free Ontario strategies for public health. We're not seeing additional dollars going into to that, although it's an important program, it's an established program of ours, it's very successful. Understanding that this year there are, when I might not have the terminology here, I'm speaking smoke-free Ontario as a general term for smoking cessation and prevention of folk smoking, but I was surprised not to see additional or a clear additional funding request. And following what's happening federally with the discussions between the federal and provincial government around legalization of marijuana and where the funds will go, what would be our ask to develop a strategy relating to informing Ottawa residents of the impact of marijuana, especially of smoking marijuana, and how will that tie into those strategies. So I assume that we're probably in the same kind of loop where we'll probably await provincial funding, but I'd love to hear from you on how we plan to develop a local strategy for that. Provincial and federal government might choose to legalize, but there are health impacts that will need to be communicated to residents.
Through you, Mr. Chair. So that's correct. We're concerned about the health and safety aspects of cannabis use and the need for public awareness and education. That's why we're encouraged by the federal announcement of funding, and you're right, we need to look at what they'll be doing to see what we can do that's complementary. Our substance use team does shift its focus, and works on many substances, whether it's tobacco or alcohol or opioids or cannabis. There's no shortage. But I'll hand that over to Jillian, who can speak more specifically to our plans.
Thank you, Councillor. So the federal government has announced funding, but from what we understand is largely that funding is going to Health Canada for their own public awareness. We've had an opportunity to participate in discussions with Health Canada about their education and awareness, and provided an opportunity to inform where they're going to go with their pieces. Our strategy overall is going to be, we have a few key areas that we've identified. We now know where the federal government would be focusing on. They're talking about impaired driving, youth, parents, and what we're looking to do is leverage that at the local level while also tailoring it to our own population with our own tools and making sure that the message really resonates with our own population. And so through that, we've had some discussions internally with city departments as well as what the impacts are, because it's a lot broader than public education. We're also looking at funding for surveillance. One of the things that we learned from lessons learned from Colorado was that there wasn't proper surveillance and baseline data, so we're also looking at that from a funding perspective, and obviously enforcement, as you were talking about. And then from city departments, everyone else has some pieces, and through that, I had some initial discussions through the federal Canadian municipalities. And so this is an ongoing discussion that's happening just not here in Ottawa, but across the province that we are participating in, and it is something that we're very cognizant of the budget pressures, and so we'd be looking at possibly a one-time funding through mid-year funding through our program-based grants.
I have no conflict with that. I think part of the challenge is with these identified priorities that it'd be relating to how it can work, we don't know what to advocate for. So when we speak to community members, when we speak to MPs and MPPs, and they say, hey, what's the Ottawa number? Like, we don't know. So I think it'd be nice for us to understand what would be our ask to other levels of government from a public health standpoint on what are the amounts we're asking for and what would those programs achieve. So maybe a note to a board when it is appropriate, when we have more context to what our ask would be.
And Jillian, again, I can't see you back there, but is the municipal task force that we're part of, they're planning to come forward with a number, an ask for financial assistance to address this?
And that's where we've gone to FCM, because I think that's where we're trying to get not looking for it just to be these isolated asks. And so we've pulled together, all the city departments have pulled together some numbers as initial proposal, high, low, what would that look like? I think one of the biggest constraints is we have a bit of an understanding at the federal level, but not understanding what's happening at the provincial level. So we're trying to make estimates without knowing all the pieces of the puzzle. So, as Vera said, yes, we have some of those numbers initially right now, and
I'll finish on this. I'd be okay with ranges. Just getting something on the table for us to have a discussion. It doesn't have to be we're asking for $2 million here, $1 million. It could just be a general framework of the types of programs we'd look for, and even if it's a wide range, just so that we know what Ottawa could be asking for. Thank you.
Thank you very much, Member Fleury, but I just want to caution you and the rest of the board that, we can't just throw numbers out looking for $1 million or $2 million when we know the program may be either more than that or, that may be not achievable. So just, Jillian mentioned, and once they get everything together, then that's the right time to come together with a number to the board and go forward in terms of acceptance or not. Okay? Thank you for that. And just before I turn the floor over to Member McKinney, I want to give the floor to Member Poirier for the 7 o'clock motion.
Thank you, Mr. Chair. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Yes, it is. Okay, yeas and nays are called. So you didn't speak into the mic anyway, so. Is that carried? Thank you. Floor goes back to Member McKinney for her Q&As.
Thank you, Chair. I just wanted to pick up on Councillor Fleury's line of questioning around the opioid crisis and what's happening. We know that the area in West Centretown, Somerset West area has the second highest need for response to the crisis, and we had 4 people die within a week in that part of the ward. 2 of them actually together in a rooming house. So the issues there are very different. They're different than even they are down in Lower Town, and we know that Somerset West Community Health Centre has been approved for a supervised injection site, but the response actually goes beyond supervised injection sites today to make sure that we are getting to the very folks who are at such great risk, and it is really rather heartbreaking to see that many deaths within a short period of time and located in a part of the city that where we know those needs are. So I just want to go back to the LIN funding, and when we do ask for an update, I know that the 1.7 million went pretty much entirely to treatment, but when they were here last time, and it is a year and a half ago, and things change, they did provide us with some information on treatment times, and that helped to influence our decision around, whether we would support supervised injection services in principle. And I just wonder if those times have changed, and I really would like to see, really would like them to come back and show us what the changes are, and if what their strategy is for making sure that we can respond as a community to what's happening in certain pockets of the city, and especially with respect to people who are using drugs in very unsafe spaces, whether it's in parks in the summer or rooming houses at this time of year, or just in kind of bunking down. So I would really like them to be here to come back with that information, because I'll have some questions for them. Thank you.
Thank you very much, Member McKinney. Anybody else? Any questions or comments? Seeing none, I'm going to, before I go turn the floor to Member Poirier, I just want to turn the floor back up to Member Taylor for his motion.
Thank you very much, Mr. Chair. So all written up now. Whereas several years previous, Ottawa Public Health received one-time funding from the Ministry of Health and Long-Term Care to work alongside partners to address bedbug infestations in Ottawa. Whereas bedbug infestations continue to be prevalent and cause distress and hardship to Ottawa residents, including vulnerable populations who require assistance in order to effectively address bedbug infestations. Whereas Toronto Public Health received sustained funding to address bedbug infestations in the City of Toronto. Therefore, be it resolved that Ottawa Public Health staff be directed to consult with the City of Ottawa staff, including bylaw and regulatory services staff and community partners, to articulate the appropriate needs request, and therefore be it further resolved that the Chair of the Board of Health write a letter that requests that the Minister of Health and Long-Term Care provide sustained funding to Ottawa Public Health for the purpose of working with partners to address and mitigate bedbug infestations in the City of Ottawa.
Thank you very much, Member Taylor. Any questions or comments? If not, can we carry the motion? Carried. Thank you. Now, I'm going to turn the floor over to, or the mic over to Vice Chair Poirier to walk us through the budget process. Vice Chair.
Thank you, Mr. Chair. That the Board of Health for the City of Ottawa Health Unit, number 1, approve the 2018 draft operating budget for the Ottawa Board of Health outlined at revised document 1 as follows. And I would ask for the first few items that we vote on each item, please. Page 5, cost share programs, 1 being infectious diseases. Carried. Chronic diseases and injuries. Carried. Family health. Foundational standards, and I note that Councillor Taylor is leaving the table. Carried. And I would propose the remainder be carried in bulk, or at least considered in bulk. Carried.
So just one more adjustment to that. There was a motion put by you, Vice Chair Poirier, about some amendments on numbers. So before I go to the report to carry that, I just want to make sure that everybody understands that piece of the information. And so if that is okay with the board and is carried, then can we carry the budget? As amended, sorry. Carried. Thank you very much, and thanks everybody for joining in on this budget discussion. Thank you, Lou, and thank you, Brenda, for your update and presentation. So now we're going to information previously distributed. Councillor Fleury had moved one item off.
Mr. Chair, I'll be very short. Just want to thank the interim medical officer of health for her time this afternoon. I did speak with Vera on the matter. I think it's important for public record to be stated that we do have a very good system, a very good team that monitor our restaurants and educate the various restaurateurs and the teams that are in restaurants to ensure public safety for food preparation and for everything that entails safety around the food storage and so on. My comment was basically that we are a year into the green, yellow, red strategy. I believe that it's probably not helpful that as members of the board we couldn't name the 5 restaurants that were closed in the last year due to not following process. I want to applaud the work of the majority of restaurants who protect the well-being of our residents, but I do think that the metrics have value in protecting the public. And I'm happy to hear that the staff are reviewing those guidelines and ensuring that we capture the true offenders and that we identify them accordingly. And perhaps for those who it acts as a reminder to all of us that the tools are all available on Ottawa Public Health website for those who want to see who are the offenders, and on the other hand, who have stellar records. And the majority of our restaurants do have that, but I think it's important that as a community we know who are the offenders, because it protects us all in terms of the work we do, but for the general public. So I just thought it was important to recognize that the team is changing the guidelines so that we will see more critical incidents in terms of the yellows, and maybe some of our community partners can help us with identifying some of the offenders, and on the other hand also promoting those who have stellar records. Thank you.
Thank you very much, Member Fleury, for your comments, and I do agree with you that some of that those items are under review with the public health, and I'm with you, though. I think positive restaurants should be promoted just as much, if not more, than the offending ones. So thank you for your comments, and thanks for that. So can we receive the IPD? Receive. Thank you. Okay. Motion to adopt report. Vice Chair Poirier.
Thank you, Mr. Chair. Be it resolved that the Chair of the Board of Health verbal report, the the Medical Officer of Health verbal report, the 2018 draft operating budget for the Ottawa Board of Health report, the update on dental services report be received and adopted.
Is that carried? Okay. Thank you. Motions of which notices have been given, I have none. Motions requiring suspension of the rule of procedure, again, I have none. And notices of motion for consideration in subsequent meeting, are there any? Seeing none. Confirmation bylaw, Member Poirier.
Thank you, Mr. Chair. Be it resolved that confirmation bylaw number 2017-7, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of December 11th, 2017, be read and passed.
Is that carried? Carried. Thank you. Inquiries and answers. There are no inquiries to report on. An adjournment. I'll adjourn the meeting this evening, but before I do that, I just want to thank Israel once again for his years of service with the Ottawa Public Board of Health, as well as Ottawa Public Health. And I also want to welcome, not officially, I mean, she's already there, she's already made the statements and stuff, member to Dr. Vera, just welcome to the board. And I look forward to working with you along with the board. And more importantly, I also look forward to working with the staff that is going to be supporting Dr. Etches. Thanks very much. Have a good evening, everybody.